I qualified when I was 21, so nursing's kind of all I've ever done, really. I spent the majority of my time within the A&E departments across the Northwest. And then I decided that NHS wasn't really for me anymore. I didn't quite like the way it was going. I couldn't nurse people anymore. I couldn't look after people the way I wanted to look after them. It just kind of lost what nursing meant for me. Hiya, Sandra. Good morning. Are you okay?
I'm okay, how are you?
Good, yeah, I'm good, thank you.
You had a good week?
Yeah, not bad at all, actually. Have you?
Because I've been up hours, actually.
Have you?
Well, yeah.
What?
What have you been like, Sam?
Same, yeah. Yeah, once the birds start and the sun's shining through the curtains. So what have you got for me to do this week? What would you like me?
Just them right tiny bit of ironing.
Yeah.
You can wipe the units if you want in the kitchen.
Okay. I love just interaction. I love patient interaction. And I love seeing people get better. I mean, that's really the nature of why I came into nursing in the first place. It's not always possible. You know, they're not always going to get better, but you can see improvements, you know, and to me that's everything. And if I can visit somebody and put a smile on their face, that's my job done for that day. If I've made their life easier or better, then that's enough for me. I still love nursing.
So,
all your medication up to date?
Up to date, Lou?
Yeah. Wonderful. Your prescription due? Is it?
No, not yet, no.
Okay.
No, I'll be another couple of weeks, I think, before it's due. Yeah.
Right. I'll go and do this.
That little bit of it, it's not much.
Right, okay, so we're going to do our group on communication skills and boundaries for neurodivergence, particularly in the eating disorder patient population.
Marvellous.
By the end of the session, I would hope that you guys can understand a little bit about how neurodivergence can impact your communication style and your communication needs. I love spending time with patients, I love chatting, I love doing activities with patients, I love just going for a walk with a patient, having a really informal chat. I love being with my colleagues. I love the human side of care, if that doesn't sound too cliche. Has anyone got anything they'd like to add? How about you online, Cass? Do you find it difficult online?
Sometimes I do. I find myself I get distracted by like a noise outside and things like that.
I think, well, from a patient perspective, I mean, this is the beauty of daycare in the respect that we've got a multidisciplinary team all within one place and with such a breadth of knowledge. You know, you've obviously got consultants, dietitians, OTs, therapists, all within one area. So you can come to one place and you've got access to all that care.
And for me, I chose to go into this line of work because I had struggled with an eating disorder when I was younger, and I attended daycare, and it saved my life and actually set the trajectory of my entire career, because I went, I want to deal with that and I want to help people in that way. And here I am getting to do that.
You are living the dream.
Get too distracted. No, me either.
Amazing. Yeah, it's amazing, the brain.
What gets in my way are policies, procedures, duplication of tasks, sharing information in 5, 6, 7 different places when I can't for the life of me understand why that's necessary. Manual data handling, why? Manual analysis of data, things like that. As a staff nurse, you have to do, but in my role now in operations, I very much have to do it. If there's safeguarding involved, you have to share with the local authority, you have to share with the CQC, and it's the same piece of information via 4, 5, 6, 7 different portals. And not only is it time consuming, it's mind numbing. And especially if you're sharing it amongst so many people, that the chance of making a mistake within that data is massive as well.
Quite often I've found the technology ineffective, really. Quite often it's not fit for purpose. The fact that you have to remember multiple passwords, you have to change them passwords every few weeks. Then you have to remember all the new passwords that you've changed, and then trying to access them, you go on holiday, you come back, you try to access all these different accounts that you can't get into. So it takes you a full hour before you've even started to actually do your actual nursing duties, trying to get in touch with admin, trying to get in touch with IT to actually get you back on the systems. It has a massive, massive impact because, like I say, it means that you can't do your actual nursing job. When nurses say these days, the majority of your time is spent documenting, they're right, it is. They deserve to have a nurse that can look after them. But when you're constantly having to log on to systems to document the same thing that you've documented time after time after time, and you just can't provide the care that they deserve.
Inputting the same data is probably one of the banes of my life. It's something that I wish I could, had a tool to bypass. For example, as a GP, you have one system for recording your documentation. You then have another system for all incoming post or correspondence from hospital, secondary care, wherever it might be. You then have a different system for x-rays and investigations, and then a separate system for bloods. So on your computer screen, you might have 7 or 8 tabs open, and you can imagine human error. Mistakes are going to happen because you can't find all of your information that you need for the one patient in one place.
Bureaucracy.
Yeah.
We've had that in our experience of trying to both chase down other healthcare providers or services or referrals, even through doing the right to choose process for ADHD, right? We were both like, we are working on this together and separately and checking that it's been done.
2 years it was.
Yeah.
From getting
so much
referred.
bureaucracy, right? For us both to have to chase and keep on top of it all the time.
And that's what I think that certainly for a patient, that's the exhausting part when you have to do that. That whole chain's interrupted, and it only takes one link, and actually somebody's care can be completely disrupted or even missed, and there can be tragic circumstances.
Yeah, when things are still being done in wider healthcare systems on a letters or emails even format, things that are really time sensitive don't get done. And there was a period of time where it was so inconsistent from getting results from the GP that Lindsay had her NHS Health app and was just screenshotting me her blood results and sending them to me over WhatsApp.
And I do it now. So I do it now if I have it.
That's the best we could actually do. And then call the GP, and it was just the jankiest ways of having to find a workaround because it's really urgent stuff.
I don't particularly like living on my own. I don't like it. No, I don't think I ever will. I don't care what people say that you get used to it. You don't. It's awful, especially when you're sat in all day and you don't see anybody all day.
What do you enjoy about Sam coming?
I just look forward, I'd probably be sure she didn't come now, wouldn't I? She's been coming is it about 9 months?
Yeah, it is now, isn't it? Your confidence has definitely grown, particularly around your mobility and your walking and things, hasn't it?
Yeah.
And like I say, I still have to tell her off now and again for trying to do too much, don't I? The other week you were talking about standing on stools and cleaning pictures, weren't you?
She hasn't got me that new stool yet.
Good.
I think she's forgotten.
Good, that's
She's
a good thing. I don't want you standing on stools.
No. I know.
To have everything in one place would be amazing. To have something that's simple to navigate as well. Because some of the systems I've used in the past, you need a degree to navigate them. And when they have to do like a teaching session on how to use, and you still don't know what you're doing, when you've got so many systems that you have to access to, you'd have to look into a complaint, and then you'd have to access a system to look at a complaint, but then you would have to access another system to look at the policy around that particular complaint. And then you would have to access another system to document your findings. Then you would have to access another one to find the notes. And, it can just be so time consuming. As a registered manager with a CQC, you have certain CQC criteria that have to be met. Audits have to be done regularly. So having your information and your documentation easily accessible to do those audits and to get all that information together. It's so important because it can make the difference of it being half an hour job to it being a 2, 3, 4 day job.
Time is this commodity. We all struggle with that. The thing that interferes with that is a black hole that I carry around in my head most of the time. And in it sits this gremlin that I haven't given him a name yet, but he's driven by worry and fear about missing some piece of paperwork, missing some deadline that we were supposed to hand something in. It isn't really the clinical side of things, but it's the tick boxes, the checklists. If that process hasn't worked as it should, and then a patient is told, we're going to have to pause your treatment for 6 weeks until this is resolved. And how do we answer that? The paperwork wasn't processed, just not good enough at all.
Every 29 minutes, someone in a care facility stops caring to start recording data. And that recording creates approximately 18,250 data points per patient per year. Why? Because there is only one nightmare that can keep any care provider in this country awake at night: regulatory compliance. And this is not because of the regulator. It is certainly not because of the regulations. The regulations are great. They're here to serve, to protect, to uphold the dignity of those that rely on us, and to make the UK's care system a much better one than any other country. The problem, the impossible problem, is the process of evidencing compliance. Right now, to prove that you are compliant, you have to capture every action, every interaction, every note, every deviation, every single day, just to evidence that care happened. And that is more than overwhelming. That is humanly impossible. In fact, it is so impossible that even the regulator doesn't review all the data. Their methodology, as we all know, is to sample a sample of the data. And this problem, this impossible problem, persists only because we have been using the wrong tools. These were tools that were built for a completely different era, a bygone era. And when your tools aren't built for the job, I'm afraid even the best care teams will fail. The single assessment framework looks so simple, right? Every care facility in the UK is governed by just 5 domains: safe, effective, caring, responsive, and well-led. Also known in many circles as the 5 reasons your team hasn't had a lunch break since 2019. But it's actually not that simple, is it? Each domain breaks into subdomains spanning hundreds of evidence categories. Everything from incident logs, supervision notes, infection control, clinical audits, end-of-life planning, resident outcomes, nutrition tracking, HR compliance, and the list goes on and on and on. Hundreds of processes, thousands of data points, and they are all multiplying by the hour. For 100 patients, that's approximately 1.8 million data points a year. This isn't documentation. This is drowning your teams in admin. People are not burning out and leaving because they are not resilient. They are burnt out because the systems we have given them have put them underwater. Let's be clear about this. The care sector really does not have a data problem. We just keep adding integration after integration. What it has is a systems problem. People looked at the compliance problem and thought, this is impossible. So we're not going to solve it. Let's build a system to capture data instead. So that is all we have done over the last 20 years. We have not transformed care at all. Legacy systems were built simply to log your care, not to enable it. We didn't stop the flood. Let's be honest. All that we have achieved is that we digitized it. We've simply replaced pens with keyboards, folders with PDFs, paper with platform. But the flood, it still keeps coming. We were not interested in building a better digitized system. We said, let's make compliance run silently in the background. We aren't interested in trying to digitize evidence. Our focus is to make the evidence self-writing so you and your teams don't have to go scuba diving in floods of admin. And as for insights from the data, those are so integral to everything. They are core and the very foundation of what care should be built upon and improved on. But instead, all we have now is that they are provided as a bolt-on, an upgrade, and you get charged more for this. To us, that is clinically and operationally wrong, and more so, it is just morally wrong. It is now time for something totally different. It is time for a leapfrog product, not another update, not a smarter dashboard. It is time to pull the plug on this data flood. It is time for a new category, and we call it care intelligence. Care intelligence isn't a system. It is a real-time, AI-powered companion for every care team. It flows with your day. It thinks like your team. It sees what matters, and it silences what doesn't. It doesn't ask you to track care. It tracks it for you. And what this means for you is countless of hours saved, stress reduced, and more importantly, human care restored. This isn't software. It is a fundamental shift on how care can be improved. Because we never set out to build a better product. We set out to build a better future.
Hi everyone, I'm Ruth and I run Health Connect. Let's pretend today that I'm a senior nurse at Rose Lodge Mental Health Hospital. To get rid of the need for using lots of different systems and duplicating data and potentially missing information, Health Connect has created one smart care platform. It brings everything together into one AI-powered care intelligence system. Let's look at how it works with the patient at the centre. Meet Robert. He's my patient, recently diagnosed with dementia. He suffers from chronic lower back pain and has been a long sufferer of asthma. On one screen, I have everything that I need to care for Robert. His daily notes, his legal status, care plans, risk management plans, investigations, physical assessments, incidents, and vitals. Everything is connected. So you put the data in once and it populates throughout the entire system. So you can use it again and again. Let's look at one prime example of how risk management and incident management are interlinked. Unfortunately, Robert's had a fall. I'm going to report the incident quickly. By speaking into the device to record the text, I save time and I'm recording the information on the go. This morning at 10:20 a.m, Robert was found on the floor of his bathroom. He said he slipped as he was going to wash his hands. He was found without his non-slip slippers and only wearing socks. He has a small cut on his elbow. Because the risk assessment is auto-connected to an incident, it prompts me to update the risk assessment and the management plan. So now I'm going to create a care plan for the wound that Robert incurred as a result of his fall. Now I can add care tasks within this care plan so my team can care for Robert with the information that they need. Together we can better collaborate and track the progress of care for Robert's wound. I know that my team is informed of all of the information that they need because of Health Connect. As a team, our most common task is recording daily notes, but in Health Connect, it's no common daily note. I can link it to the right care plans and risk assessments. Health Connect also automatically logs any vital sign readings that I take as daily notes. So no more scattered data or duplicated data, and this enables one magical feature, AI shift handovers. Now it's time for me to hand over Robert's care to Tanya, my night shift colleague. So I've generated a shift handover with Health Connect's AI. The AI daily note summary captures everything that happened over the last 12 hours or longer if I need to, from care plan updates to risk management plan updates, the incident, and any vital sign readings, of course. It saves me so much time rather than compiling all my notes and then writing out my shift handover right at the end of my busy day. And that's not all. That's just one example of how Health Connect flows with my care team's day, cutting out the unnecessary noise. With the patient at the centre, this interconnected data flow allows for one more thing. It'll be ready soon for all care providers using Health Connect. It's the solution to the impossible problem of compliance. Devon's going to take you through exactly how we'll do this.
Now, let's look at the way it can be done. Not just the way it can be done, but the way it needs to be done. One clean screen, real-time compliance, zero duplication, zero stress. What you will end up with is a live feed to show your real-time compliance across all 5 domains. Yes, real-time compliance. That means that you can generate risk scores across all of your domains, click automated assessments, and this is where you can have real insight into your compliance readiness. You'll be flagged with areas for improvement so that you don't have to guess. The analytics is done for you. And all of this is thanks to one living record. We have created a single source of truth that includes every aspect of care. Everything from your care planning, your daily records, your risk assessments, your management plans, your incident management, anything you can think of, the compliance AI has oversight across all aspects of care and will provide you with intelligence in real time. This is not just digitized. This is not just centralized. This is real intelligence. This is risks surfaced before they escalate. Compliance, handled behind the scenes in real time. Audits, accurate, effortless, and most importantly, instant. Remember those 1.8 million data points we spoke about? Dealt with instantaneously. And as impressive and as advanced as that is, it is not the most impressive part of what we've built. This is what is. An inspector calls. You open up your audit hub. One click, one single click, and your full CQC compliance report is there. For the first time in care history, compliance writes itself. This is a jailbreak. This is the moment that you have all been waiting for, and you have just been given the key. And that key is available to every care provider in the UK today.
Home visit, Sunday, 18th of May, 11 a.m. to 12 p.m. I like the fact with Health Connect that you can set myself little tasks every week. So rather than having to remember specific things for specific clients, when I log on for each client, I have a bar at the side where I can see all my tasks for the next visit. So it gives me little prompts as to what I need to do on that particular visit. Did you hear it, Sandra? Good. Do you want to press your bracelet for me? Right, no. Yeah, please.
Your alert has been received.
Hi, good morning. It's Sam from Riverpath Care. And it's really helpful with things like checking smoke alarms or checking the lifeline bracelets and things like that. Things that you might not necessarily think of straight away when you get there because you're quite focused on looking after the client. Lifeline appears to be working. With Health Connect that you can have like a where I am now and where I want to get to, so you can have those conversations with your clients. It's like a way of them looking into the future, you know, to say, well, I know that I'm walking with a Zimmer frame now, but in 6 months' time I'd like to be fully mobile again and be able to walk around the house without anything. And it's like sets that little goal, which we all like little goals to achieve, don't we? So things like that just kind of give you those little bit extras that I've never had before. There's not really been a system out there that's kind of giving you that little prompt and that little push of just have a think about this, do you need to do it? And it's such a help, it really is.
What I like about Health Connect is Health Connect enables me to amalgamate all of my clinical notes in one place and also allows me to collaborate with other members of the MDT and ascertain what they have, their perspective on the patient from that particular day, which is easy to view, easy to find, and easy for others to understand as well, which is often where things can get confused in other systems because information is sort of dotted around in various different places.
Health Connect is revolutionary, there's no other word for it. I can click a button and know if every single patient within my service has an in-date care plan, an in-date risk assessment, and whether they're effective. That's huge from a management perspective and a compliance perspective. I can go in and see if my care plan and my actions are relevant to my own policies. That just saves so much time. Health Connect does that for us. Not just the platform of Health Connect, but the team behind Health Connect understand healthcare. They're not a team of tech developers who think, I know best, I'm going to do this. Half of the team are clinicians themselves, and they understand the needs and they understand that you have to do things in a certain way.
Health Connect is one of the simplest systems that I've used, but it's got the most detail in. And you won't believe it until you see it. It's streamlined to the point where it gives you the information you didn't even know you wanted when you open it up. It's brilliant, and it does again mean that you can give patients more of your time.
For me, it's about quality. It's about providing that meaningful experience to somebody. With the systems that we have with Health Connect, it's about bringing that family together as well. Excuse me one second.
I think
Thank you for calling Riverpath Care. This is Kate. How may I help you? I don't know of any other system that allows families to see the real-time things that are happening with their loved one. It's about giving them peace of mind. And you look at other systems, it's like, yes, we gave mother a bath today. Yes, we gave mother a cup of tea. But it doesn't tell you what kind of day mom had. And it's not just that tick box exercise, it's that full narrative. For me, it was about getting the right type of technology, one that was moving things forward in healthcare. I want one system, not 5 or 7 different systems. I need something that's easy, takes the effort and the time away from doing the day-to-day tasks that are required to be done, where we can put the emphasis back on the care and back into that human element, that kindness, that compassion, that dignity for delivering care.
We need to give these healthcare professionals the resources, technology that they need to enable them to do the job effectively and ultimately provide a service that's effective and safe for patients as well.
We have a wonderful team and they do the best that they possibly can. And if life could be not just easier, but the ability to deliver higher quality care, which is what everybody in the team strives towards, if we can give them technology that facilitates that, no-brainer. My message to fellow clinicians is you need Health Connect.